And something that you mentioned earlier is that I don't want people to get confused by, it affects it's a gender, so it affects girls and boys. So don't only look at the female child or the girl child, but look at the boy child too, you know. So I think that's quite important.
If you could mobilize a group of people, what movement would you mobilize and why?
I would call my movement the mindful movement. Suicide is one of the leading causes of death between people aged 15 and 29. 1 in 3 people are expected to suffer from mental illnesses in their lifetime. So I believe that mobilizing people to strive for mental health would actually fix so many social ills in our society, and that is what I would mobilize.
Child sexual abuse. And welcome, by the way, this is Dr. Kim Langston. She's a psychiatrist, and tonight we're going to be speaking about sexual abuse in children. And as I've seen through the comments, I don't know if you've been seeing the comments, Doctor, there are a lot of people that have struggled with it from childhood and have carried it into adulthood. And I think it's quite important as we delve into this topic to talk about the long-term effects as well, because I was reading how it affects so many people, so many marriages, because you can't find that root cause, because also our brain has the ability to suppress traumatic events. So yeah, I'm really I don't want to say excited, but I'm really keen for you to expand on that. So the first question that I have for you is, what is sexual abuse? Because I think one thing is being able to identify it. I mean, the first time I heard about sexual abuse was in an LO class. But then you realize that, okay, no, maybe this wasn't supposed to happen, maybe that was not supposed to happen, and a lot of people don't know how to identify it. So what is sexual abuse, and what should we look out for as adults and children, or just adults in general?
So thank you so much, first of all, for having me on Instagram Live. I think it's an incredible opportunity for us to talk about mental health, but I think children and adolescent mental health is something that is kind of put to the side, and it's dealt with as a kind of all the very kind of important people are going to deal with it, but it doesn't affect me, and I can't do anything about it. So I think it's wonderful for this opportunity to be able to really speak about it. So childhood sexual abuse has actually got quite a broad definition. It's essentially, so it's divided up into a few groups. First of all, it's agender. So it doesn't, males, females can be affected by it, and it doesn't mean that a particular person, it can be male and or female that inflicts it. So it doesn't have to be specifically gender specific. The other thing about it is that they classify it as penetrative or non-penetrative. So you can, understand that it's not just about rape. It's about exposure. Statistics are not completely confirmed, but up to 90% of children that are abused at some point from a sexual perspective are actually abused at the hands of someone that they know. And as someone who is not directly involved in that personal life of the child, if you suspect, and you know what, you don't have to get it right. If you suspect, and let me just say that human beings that care, their gut is often correct. So if you, as a teacher, as a parent of a friend, anybody who goes, I know this child, and there is something that is off. There is something that I don't feel is right. Start with a child. Start with forming a relationship with that child, because they're looking for a sense of safety. They're looking for a place where they can go, and usually it's just one person, especially teachers. I think schools have got this unique opportunity because they spend so much time with children. They have this unique opportunity to build a relationship with children and understand who they are, and then notice changes in a particular child's behavior. So start with the child. You don't have to ask direct questions like an adult, but you can ask them how home is, how they're feeling, what do they feel about their peers, how's dad, how's mom. You can ask these very brief but general questions. The other thing that you can ask a child to do, if you want them to maybe elaborate and they don't have the words, is ask them to draw things. So get them to draw the home environment, get them to about their holiday that they went on, who the various people were, if you suspect. Now, if you still suspect, and there is no evidence once you've even got the child to speak to you or at least be with you, you actually, as an adult, you have a legal obligation to actually report it, which is a really good thing because you're protected by the law, even if
you're wrong.
It's not accurate. When I say accurate, you're suspecting, and perhaps it's not completely exactly what you were thinking it was, but you actually have a legal obligation to report it. So, child services, child protection departments, the police, whatever you can do to protect that child, because ultimately the law wants you to protect the child. So those services are available. So from your humanitarian moral perspective, it's good to engage and it's good to talk and try and get a little bit more evidence. But if your gut tells you to go and maybe be a little bit proactive, the law protects you to look after children.
And I'm glad you said that, because sometimes you don't always have to be accurate, but if you suspect something, our gut feeling is usually often like right. And even if you're not, you've actually just tried to protect a child. And something that you mentioned earlier is that I don't want people to get confused by, it affects it's agender, so it affects girls and boys. So don't only look at the female child or the girl child, but look at the boy child too, So I think that's quite important.
We are born with an innate temperament and an innate resilience. So although we see these statistics and we go, oh my goodness, 33% of people or young children or adolescents have been exposed to this significant trauma, we still see an adult population that is quite functioning. It doesn't mean that they're not struggling, but they're able to work within the world that they find themselves. Now, there's a very, very interesting book, which I think if anybody's interested in this and they want to be moved, there's a book by a psychiatrist called The Body Keeps the Score.
The Body Keeps the Score.
The Body Keeps the Score
by
Dr. Basil van der Kolk. He's a Dutch psychiatrist, and actually I'm so glad I read it quite recently. It was advised that I read it by a number of people, and it's all about trauma. It's not just about sexual trauma, it's about all types of childhood trauma, going from neglect to extreme physical forms of trauma. So not to compare, but it is this range. And he talks about especially children, and maybe I should focus on this a little bit, children, little ones. And I'm talking about children that don't have the vocabulary. They're still developing their language center in their brain. They're starting school. They're living at home. They're at the mercy of whatever caregiver is available to them. What happens to those children that experience this significant form of trauma being so young? So they accumulate diagnoses. And this is where the education of the mental health care practitioners and the general practitioners, anybody who deals with children, needs to understand. And Basil talks a lot about this in his book. Basically, children present with behavioral problems. So often they're trying to fight something. They're trying to make sense of this internal anger, this internal disarray by acting out. So they break things. Again, the school refusal. They hurt other children. They bully. Okay? And adults see this as a child that is difficult. The child that is just trying to be destructive. Actually, it might very well be a way of communicating this internal distress because they have no other way of communicating it. Okay? Other children completely fold inward. All right, they become solitary. And those children are generally diagnosed with depression, with anxiety, with sleep problems, and they accumulate these diagnoses. But actually, the real reason for them not being properly treated is because the real core, which is the trauma, is not addressed. So if we just had we've got general practitioners, we've got psychologists, we've got psychiatrists who are really involved in this, in that they forget the behavioral stuff. They go, okay, so this is a symptom. What is the cause? And they go back and they deal with the trauma itself. And that is absolutely fundamental to managing children with trauma. diagnoses and medications onto them. Okay, which is often what we see. And they get diagnosed with all sorts of things, bipolar, whatnot. Meanwhile, they're actually dealing with a trauma that they can't actually, they don't understand it. It's just a yuck feeling that children have. As adolescents, there are a couple of long-term consequences of it. Substance use is one of the big ones. So they self-medicate their pain. They self-medicate their anxiety and their depression and their sleep and their, when they go out with friends, they've got to be a part of the crowd. They need to be accepted because they feel that they're not accepted by themselves. So alcohol, drugs, that is a big comorbidity with trauma. So it's the substance use disorders that become quite profound, and that carries them through and accumulates all these other diagnoses, of course, into adulthood. So there's sometimes a forensic diagnosis, so there's crimes committed. But the real reason for that progression in their behavioral problems, in their psychiatric comorbidity, is because of the trauma. So I think the point that I'm trying to make is we need to catch it early. We need to identify it early. We need to give those children a voice that is safe. And we need to provide those littlies, whether they be 2 months old or whether they be 17 or 18 years old, with a platform to know that they're safe. Because then they're not going to look for external validation to make them feel better, but they're also going to be able to feel safe in their own bodies. So there are multiple presentations that originate from trauma going into adulthood, and I can literally talk on this all night. But I think I've probably covered the predominant presentation in young children going into into the pre-adolescent phase, and then young adolescents going into the early adult phase.
There's so many things that were running through my head as you were talking. How we live in a society that asks, what was she wearing? How do you ask a 3-month-old what were they wearing? I have so many questions in my head, and also talking about, I'm glad that you spoke about how different psychiatrists or even psychologists will diagnose a person with different forms of mental illnesses when the root cause is just the fact that they were dealing with trauma. And it says, I hope that a lot of psychiatrists and psychologists are at a stage where they try to find the root cause instead of just diagnosing and just giving medication, because long-term effects of that, it doesn't really help with anything, And I often wonder, what do you think of because there's some people that have so much trauma, I've heard about how the brain can suppress a memory but can still affect you up to adulthood and all these things, and I'm wondering what forms of help or can you offer that person, because I'm even thinking about how I've even read about hypnotherapy, how some people even have to go to hypnotherapy to help, and how it's also quite important that in as much as we can get medication for things, it's also quite important to supplement it with talking therapy as well. They work hand in hand in order to actually just find the root cause of what is wrong instead of self-medicating, because it's almost like there's a rippled effect that started, let's say you were 6 or 7, and now you're 30, but now you're taking all these medications, you're struggling with substance abuse when the root cause of what is wrong is not actually identified. So I'm not sure what question I'm trying to bring out of this, but it's just it's very alarming. What help can you offer people instead of just giving them medication? What help can you offer people that have gone through trauma or don't even remember that they went through that trauma when they were young? What resources are available for child sexual assault, not only for kids but for adults too, that don't remember that they were actually sexually assaulted? They just have this anxiety that they live with every single day, or they're just going through, or they've just been diagnosed with so many mental illnesses when the root cause is child sexual abuse. And it's actually quite sad that something that happened to you as a child can affect you throughout your entire life and lead to so many range of illnesses and social ills. What resources are available for these people?
It's wonderful that you're asking this question, because as difficult as the question is, the answer is just as difficult. So I'm going to try and make it as simple and as structured as I can. So first of all, you mentioned that talk therapy is a supplement to medication. It's actually the other way around.
Oh, really?
Medication for, let's call it post-traumatic stress disorder, which is generally how people present with this, and just for PTSD, just for sort of general understanding, it's this obviously exposure to significant And there's a whole bunch of specifiers, but the point is avoidance of things that remind you of it, nightmares, disassociation, and hypersensitivity to things that remind you of this particular trauma, cognitive changes, mood changes. So PTSD it's a very difficult diagnosis to make. But once you've decided as a clinician or as a medical health professional, and I mean OTs, psychologists, GPs, I'm not confining this to psychiatry because often that's where the children go first. Once you've decided that there is a trauma and this could be resulting in the presentation at present, like the presentation now, medications, we file them. We treat the mood, we treat the anxiety with medication, but that is not going to change how that person experiences life. And there are, unfortunately, in South Africa, and I'm hoping that with time our mental health care advocates, like on this platform, can motivate for more training in these spheres of treatment, as well as for medical aid, as well as government support of these types of therapies. But there are very specific therapies that we do for trauma. And one of them is eye movement desensitization and reprocessing therapy, EMDR, which is a form of psychotherapy. And it is absolutely fascinating to read up on this because the evidence to support this particular treatment in the improvement in significant long-term sustained sexual, physical, whatever type of trauma it is very, very good. But you've got to have people that are trained in this particular type of therapy. Now, we don't always have that. We often don't have that available to us. So we do tend to resort to medication because what medication allows is for the symptoms of the depression and the anxiety and the sleep, whatever, to be just managed a little bit so that they can engage with a therapist who perhaps isn't trained specifically in trauma, but they can form that relationship and feel safe in that environment, where they can go and they can talk about what they can try and remember. And I'm going to go back to what you originally said. The brain, for me, is an absolutely wondrous organism. Because the brain protects us. So what we do is we learn ways of sort of, when we experience something in our environment, especially with children, they can't make sense of it. That's why we have primary caregivers. That's why we have parents to go, okay, well, this is a dangerous situation. You didn't enjoy this situation. This is a horrible time for you, but I'm going to hold you and I'm going to make you feel safe. Children that don't have that, and that sort of protective mechanism is absent. They understand that this is a yuck feeling. They can't describe it, but they know that it's horrid. So they learn ways of protecting themselves. So one of the things that they do is they disassociate, which means that they package this horrible feeling into a place which they don't need to deal with. And what happens with that is it remains. So when you go into late adolescence, adulthood, even later adulthood, that suitcase of emotion and that suitcase of disassociation is still there. So when you are exposed to any sort of trigger that might be associated with initial trauma, you're going to unpack that suitcase. So those emotions are going to erupt and they're going to come out. And that's where the trauma counseling comes in, is unlinking. It's decoupling the early childhood trauma with the current experience that you're having and going, actually, I'm safe now, but I'm experiencing what I did when I was 5. So it's a very specific type of therapy. Fortunately, if anybody Googles podcasts on mental health, they'll find that there's a lot of research going into PTSD in America and the various academic forums there, which is great. I can't say that it's going to reach our shores too soon, but what I can say is just the awareness of trauma in children and finding it early and finding those children and working on the resilience resilience that they already have innately in them, and identifying them and making them feel safe is absolutely key to trying to prevent that cascade or that domino effect of mental health trauma and that experience into adulthood.
And just to close off, like, what do you, because I see a lot of people sharing their stories, and thank you to everyone that's sharing. And like I said in the beginning, don't feel weak if you can't share your story just yet. You don't have to relive the trauma for anyone, and not even for us. What do you say to a person, someone who's watching now, and they had to go through that, and they're still dealing with the long-term side effects of the child abuse? Because I see a lot of people sharing their stories, and I wouldn't know what to say to them, because after hearing the stats and everything else, it's just alarming how many people go through it. But what do you say to that person? Like, what do you say to that person that's watching, that has gone through this, that is still living with the trauma, that is still living with the PTSD, that is still living with the anxiety, the depression, or the after the side effects of just those events that happened to them as a child?
Such a good question. Let me put my brain to that. So, I would say that to that particular person, the person that puts up the comment or comes into the room and says, this is what's happened to me, my first reaction was, it was wrong. In no way was that okay. In no way do you have to feel guilty. It was not right. We don't often have the opportunity to get justice, although I'm very much an equilibrium person, so I believe there's justice at some point. But right now, you might not be able to get the justice that you deserved, but it doesn't mean that it's not important, and you're important. And sharing your story with someone that you feel safe with, someone that you know that is not going to tell you what to do. It's just that person's going to listen. Sometimes the best therapy happens in silence. You are important. You are here. You are here for a reason. And what happened to you is not okay. But let's talk. Let's find resources that are perhaps, and there are resources. There are lots, not lots, let me clarify that. There are several resources that have got a profound passion for this type of therapy. And you're here. Let's see what we can do now. And you gauge it based on the person's ability to manage those hard, difficult, dark experiences that they had 20, 30 years ago, but they're here, and that's what's important. The other important thing is that I always say to parents that have been abused themselves, that have got now children, they're fantastic parents. They are doing something really, really good for their children because they're protecting them, and they know what it's like to feel that pain. But they're being great parents, and you're here, and let's see how we can move forward together.
I think one thing that one psychologist once said was, speak until someone hears you. I think being on this platform and actually speaking about mental health every single Monday, you get to realize that there's always someone listening. Like what you just said now, even to the parents that were actually victims of child abuse or child sexual abuse. Speak until someone hears you. It's never too late. And just because, like you're saying, you didn't get justice then, doesn't mean that your experience needs to be invalidated in any way. What happened to you was not right. It was not your fault. Please just remember that. And again, thank you so much, Doctor, for coming through. This has been an amazing session.